Hello, I'm Megan, and I am shooting this video a little over 9 months out of my L5 S1 microdiscectomy. It's not good news today. Well, it's not really news, it's just not a great update. For those of you who've been watching along and following along, you know I've been having some pain in my butt, basically my piriformis and my hips, and it's been difficult for me to really just get around. Not as bad as before surgery. I can still stand up straight, but I'm in a lot of pain in my hip and my nerve pain has returned. After, massage, dry needling, new PT routines, rest, heat, Advil, I decided it's time to go see the spine doctor. So I saw the spine doctor yesterday, and he says since there's nerve pain, we have to rule out a reherniation. So I'm supposed to be getting a call this week to have a new MRI done of my lumbar spine and sacrum. And I'm not sure what I want it to show. I don't really get a choice, but if it's a reherniation, I'm not really quite sure I want to go through another micro. We'll see what it shows. If it is not another reherniation, we have to do more imaging with like an injection contrast. And we'll go lower into my pelvis to see if we can't figure out, which makes me nervous. So anyway, either way, I don't know that surgery is really the option I would want to pursue with whatever's going on. And I'm not a big fan of injections. Number one, because I'm kind of a chicken about needles. But number two, I'm also not really a fan of injecting chemicals and things into your body that don't naturally belong there. The choice to have my microdiscectomy was, in my opinion, not a choice because I could not function day to day. I can function day to day with this. I cannot do activities that I enjoy and that I would say lead me to live a fulfilled life, like my sports. Can't run, can't snowboard, can't do yoga at this time. So anyway, I wanted to share with you guys something I'm going to explore. And I'm just going to say what it is because I haven't been to it yet. And if any of you have done this, I would absolutely love to hear from you. I met a gentleman a year or so ago in a business group. I'm a business owner and he's a business owner. And what he does is he has a clinic and he teaches a method called the Egoscue method. And I've only begun reading this book that he recommended that I get. But I'll show it to you here on my Kindle. It's called Pain Free, a Revolutionary Method for Stopping Chronic Pain, written by Pete Egoscue, and that is his last name. And they have these clinics like all over the country. And the guy I met and know, he owns, or I guess it's a franchise, I don't know, but he has these two clinics in Denver and Boulder here. And he's been reaching out to me because he's been seeing my sharing and watching my journey. And he's been reaching out to me from the beginning saying, Megan, come see me. Megan, come see me. And I'm going to reach out to him and go see him. I have no idea really, other than from the 2 chapters I've read from this book, what it's going to be like. But it's not necessarily physical therapy from what I understand it. It's just techniques to like retrain your body to be in the proper position so that when you do move your body, you're moving it the right way and your mechanics are all like the way they're supposed to be. I'm sure I just totally butchered that, but that's my general basic at a glance understanding. But I'm going to do that and see what it's all about, because right now nothing else is working and it's really hard for me to be a lump on a log. I've missed out on most of this snowboarding season, and hiking season's right around the corner. So, you know, I know I'm not going to hike a 14er this summer. And I knew I wasn't going to be like 100% on my snowboard this year either, but I really didn't think that a year later, 15 months later, I would be back with nerve pain. I thought, oh, my muscles will be sore. Oh, I'll be struggling with like my stamina. That's acceptable to me at this stage. Nerve pain? I'm really pissed off about this, guys. So, anyway, update, a little over 9 months. And if any of you have done the Egoscue method for this injury, whether you did it and decided not to have surgery or whether you had surgery and then this helped you during your physical therapy and recovery, I would totally love to hear from you. I have absolutely no idea like what the financial commitment is or the time commitment or whatever, but I don't care at this point. I need to figure it out. Yeah. Thanks for watching, guys.